All right, so thank you. We're going to try this because I am a normally loud and obnoxious person without a mic. So just let me know if you guys can't hear in the corners or anything like that, and I will mic it. Welcome. Thank you for coming. This is going to be a sort of free flow kind of moment because he gave me, like, you know, he said I could do whatever I wanted. So, with any medical talk, you know, you have to give the biases and you have to let people know that the drug companies did not support you in producing this. So I'm just going to say, no drug companies paid me to do this talk. And, yeah, right? And in addition, I do have to thank the guys from Canary Coalition and Occupy WNC for coming up with this and putting a lot of their time and energy into sort of continuously keeping this at the forefront of people's concerns. So, donations for them are always welcome. There's information on my nonprofit at the back too, and if anybody has questions, we have people that can answer stuff at any moment in time, but we're happy to say we now have a federal nonprofit to back us up in our sustainable living. So, first question for people. How many of you feel like you have fatigue on a daily basis? Just show of hands. All right, you guys are like too healthy and y'all have to go home now. All right. Geez, you blew the first part of my talk, come on. Okay, so this is the traditional, like, essential picture on fracking. I am not a geologist. I'm not even an environmental scientist of any sort. So, you know, water comes in, blows up the shale, methane comes out. I think one of the interesting things in this whole process is everything else that goes on around making these wells. And this is also the obligatory, this is what fracking is. So hydraulic fracturing would be creating these wells that then freeze the natural gas, and then as the natural gas comes up, we all pay less for natural gas because, have you guys noticed that yet? You're paying less for natural gas? I don't use it, so I didn't get that piece of information. But if you do use natural gas, you may be paying less for it at this point because there are so many fracking wells outside of North Carolina. Materials involved, the vast majority of materials that we are using is simply just straight up water. 1.5% of the materials is the silica sand, and then only 0.5% of the materials involve the chemicals about which most of us are concerned. But we should, of course, be concerned about everything that's involved in the process because all of these materials can be scarce / non-sustainable. I mean, what are we going to do when the sand runs out? So, rough numbers, Pennsylvania in 2012 had over 5,000 wells, and over the lifetime of each of those wells, you're looking at 9 million gallons of water being used and about 100,000 gallons of chemicals and radioactive chemicals, so the bad stuff, right, being pumped out every 4 to 6 weeks. So I think one of the big things is that this is just not a small strip mine that only affects those portions of the territory in which the badness happens. This is something that's just happening on a macrocosmic scale, and that's one of the big problems. Determinants of health. Everybody has, of course, a different health profile, and there are certain things that you can affect and certain things that you can't affect. Anybody who can affect their age, please raise your hands. I need to talk to you afterward. Oh, all right. Just trying. Genetics are also something that we can affect in some ways by trying to neutralize what our parents have given us or to act on it. Things that we can affect, of course, would be the things that are environmental, that are coming from outside. And then we have the interactions, right? At both ages spectrums, from being early in life versus being late in life, we're going to have more of the environmental impacts actually acting on us in a bad way. And then the genetics. There are some people who are predisposed to cancer, and if you add on a certain trigger to them, they're going to get it, whereas some people do not have those triggers. And so they can walk through life and be like, benzene? Oh yeah, I bathe in that every day and I'm fine, right? And then other people are going to be like, I have fatigue. So we have many, many limitations of information, and that is the biggest problem, as I explained when we started this process, of the entire discussion, is that we don't have a lot of information, and the other problem, though, is we're not going to be allowed to create a lot of information at this point. So the basic components of our research that we would normally do, we can't do. So we can design a scientific research project, but there are multiple reasons why those research projects may or may not happen. The biggest part of that, of course, is that monitoring of all of this stuff is not really happening because the government has exempted many of these companies from the things that are supposed to be used to monitor for safety. The Clean Water and Clean Air Act are basics among these, of course. Also, scary but less well known, is that we do have underground injection control requirements. And the oil and gas companies have also been exempted from these requirements. So, if this is not scary enough that we don't have incoming information, let me just say that we also have gag orders. And that these gag orders have prevented people from giving outgoing information as well. So that if somebody has had a bad outcome, they have a gag order slapped on them at the end of their settlement to cover all their medical bills. So, in addition to that, I'll get into this later, there are gag orders being slapped on physicians as well, and on multiple other places, so that it's really hard for us to collate the data properly. So, environmental impacts. They're basically come into three different categories. One is the habitat in which we are living and the effects that fracking will have on this. There's the air pollution and there's the water pollution. In large part, what we're saying is that the infrastructure is going to affect the habitats. Well, you know, I go back to history on this one since we don't have current information because they won't give it to us. I'll go back to the strip mining. Okay, we all know that when we build something, we're going to have an impact on the environment, and that those impacts should be sort of evaluated ahead of time. But of course, they've been exempted from that as well. So the physical structure, the transportation issues, because they're hauling massive amounts of water in and hauling massive amounts, well, half as much wastewater out. And then the waste management, which they are exempted from as well. They don't actually have to treat the water. So I think in a nutshell, I just want to put out there that one of the most horrifying pictures that I saw while I was researching for this talk was a beautiful Pennsylvania farmhouse with a big old fracking well in the background. So just put this in your head, and then as you drive home tonight, make sure you put several of these on the hillside, steep slope. And then just, you know, go to bed happy. All right, so disruption of habitats. We have an awesome, unique ecosystem here in Western North Carolina that's just one of the most unusual in the world. Earthquakes, any kind of sound. There are actually now studies about sound damage on different levels because this has to be on some level. If it's that vibrational that it causes earthquakes, you know it's got to be a noisy place in some level. And imagine what that's doing to all the microcosms that are still underneath the earth. The infrastructure, just the concrete pads, you know, the wells themselves, the roads that they're going to build to haul in the water and take it out. And the waste management, because there are, in Pennsylvania, daily spills. So it's not that it's an if, you know, if your nuclear reactor blows up, what do I do? This is one of those that when the spill happens that day, it just depends on what hour it happens. Research on animal habitats would be awesome, and a lot of people are now going to the veterinary literature and looking at the animal outcomes in terms of this cow got to drink out of the spill water, this cow didn't. And so they're starting to actually evaluate those and look at outcomes data just for the animals, which may give us better information in terms of whenever you do animal research, and by this I mean just like doing nutrition research with cows, for example, you can always control your environment better, right? There are less factors. You don't have to worry if the cow went to McDonald's or something and screwed up your nutrition study. So you get better data. So actually the research on the animal data is probably more accurate than what we're going to get out of people data, because there are just too many variables and you can't make sure everybody had the same X, Y, or Z in your people data. So the animal data is going to be very important. And I think, oh, and over the weekend, shoot, I forget which state it was in. Thank you. See, I don't have to remember this. I'm just going to sit down now. Had multiple events. The largest was like a 4.2, I think. I don't know if you guys have ever been in an earthquake, but a 4.7, it gives you a reasonable shake. You know, that's not something that you go, oh, the picture just moved on the wall. That's one of those where you go, what the heck? You know, so you can imagine that this is going to cause potentially loss of life and outside money that, of course, we know from experience the oil and gas companies are totally going to cover any thing. So, okay. So getting down to our infrastructure, the other part of the infrastructure is the people. I was so excited to see that Governor McCrory was excited about the between 400 and 500 jobs that fracking was going to bring to the state. Because I think that's like, I don't know, 1/1000th of the amount of jobs that we need. But they're going to be great jobs because these guys get to breathe in benzene and silica all day long. Who would not want that job? Right? I'm sorry?
You have not mentioned benzene. Is it one of the chemicals being injected?
Yes, but that's like slide 36.
On your list.
But I haven't given you the list yet.
You gave us a list.
Nah, I didn't give you the real list. I gave you the fake one that they gave me. No. I'm going to give you the later list. No, but I mean, it's, yes, actually, one of the things that they have noticed, the methane and benzene emissions from the wells themselves are hazards to workers. What they have admitted in the public is that OSHA has had actually put a hazard alert out for the inhalation of the sand and the silica. So on the one hand, you're going to have all these awesome jobs. On the other hand, all those like 500 people are going to have health insurance that will cover everything that happens to them. So highway crashes, injuries, this is not necessarily a safe space, but also every time you get a highway crash, you're going to get a spill as well. You know, so you've got plenty of things in terms of simply hazard to workers without even having to go outside our space. And of course, the spills give us potential for other things. So the National Institute for Occupational Safety and Health did put an alert out and said that silica was a health hazard for the fracking workers, not just anybody else. Amazingly, they didn't get sued for this. Oh, so let me throw in my bias also. I forgot to put this in the bias part. That these guys had no idea what I was saying today, so they're not responsible at all. So silicosis is what we're really worried about. And if you guys aren't familiar with silicosis, you may be familiar with asbestosis, which is the same kind of concept. Small particles sticking in the lungs. Add a little bit of cigarette smoke, it's really bad. Add no cigarette smoke, it's moderately bad. And you end up with a lot of people with permanent lung damage or inability to breathe, which is only slightly incompatible with life. So, then again, we have health insurance to pay for that now, so we're good. Okay, so air pollution. Let's keep going with the lungs. Diesel. So not only do you have the methane and you have the benzene that we've documented, but you also have diesel fumes. So just as you imagine all of these trucks hauling these large amounts of water up and down the roads to all of these multiple wells, every time they drive by you, they're giving you a dose of diesel. So in addition to the workers that are inhaling this, of course, you're also getting this in your space, and if you're living on the road or anything like that, it's okay, just take a nice deep breath. But the initial blowback, and by that I mean when you create the well, and you've built it, and you throw that initial dose of water down there, my understanding is then the gas comes back up. And that's what they call the initial blowback. So it's a little bit more intense phenomena. I guess it's similar to what I imagine when they set the oil, when they set the oil on fire, when they have an oil well or something and they know they got oil. I don't know. Not from Texas, sorry. So what this does is this gives you elevated levels, of course. So this isn't just like a moderate leak or anything like that. This is like a nice huge plume into the air. So we've built the infrastructure, we've killed all the bunnies, and then we've breathed in all the silica to create this, and then we get that first awesome dose of benzene and methane. These both are chemicals which at the first are inhalational, of course. They're associated with cancer and known carcinogens. In addition, they create an ozone layer, so they contribute to the low-lying levels of ozone on the ground level. So ozone. Sometimes it's good, sometimes it's bad. It's all depending on how high it is. Good ozone would be the stuff that stays high. There's got to be a moral in that somewhere. Bad ozone is the stuff that stays low on the ground, okay? So the problem is that, of course, what we're doing is when we've got this blowback and that kind of stuff in there, we've got low ozone. This is not stuff that's being shipped to the upper atmosphere and providing our protective layer, which is being destroyed, and that's, you know, the other part to worry about. If only, so here I was coming up with this great idea of taking those big pumps and somehow pumping all the low-level ozone up to the upper-level ozone and like totally fixing the world with fracking. But then I figured that was like way too much stuff we'd have to build and nobody would pay for it. So anyway, so what we get, because it's low-level ozone, is we get bronchitis, asthma, emphysema. We get all that awesome lung stuff happening yet again. So, and I'll tell you baby impact a little bit later, because of course I'm an OBGYN, so I only care about the babies. Sorry, moms too. So, okay, National Ocean and Atmospheric Administration. Did I get that right? One right? I could be wrong. Oceanographic in Colorado has noted. So these guys are doing some monitoring. They're doing what they can. It's not the state mandated stuff or anything like that. But high levels of methane, benzene, and volatile organic compounds, which is essentially other toxic chemicals being expressed. So I'll take that step back and say one of the things that we've been trying to do in houses when people renovate is make sure that they have low VOC carpets and paints. So just by knowing that, you can imagine that we want the VOCs relatively lower and that they're not good emissions, and that if you're doing them in large quantities throughout, it really, really means that extra like $5 on your gallon of paint is totally worthless, because it doesn't matter how much VOCs your paint's putting out if you're inhaling it anyway. Methane was 3 times higher. Benzene of the VOCs, 7 times higher. And in fact, federal standards for ozone air quality are totally not being met. Didn't see anything where this was actually being addressed in terms of if it's not met, then we clean it up somehow. But in 2012, the study in 2012 associated one well alone with 50 airborne chemicals, 44 of which were pollutants. So these are the studies that we do have, basically. Those that I showed you on the previous slide. These are some of the shale that they are fracking in. So they're fracking in, of course, multiple states and Australia and England and several places overseas as well. The Barnett Shale had increased levels of methane concentrations proved in multiple different studies. West Virginia had elevated benzene, and the Eagle Ford Shale. So this is one of the problems with the studies, is probably 50% of the studies and the information that I looked at were discussing potential hazards. We really think that benzene's bad to spit out, and we'd like to study it some more. And so they're more like statements instead of actual documentable data kind of things. So the first couple are documentable data kind of things. And benzene is because I had to actually throw the medical stuff in here, is you can either inhale it or ingest it. Good to know. And the biggest carcinogen or the biggest cancer that it causes would be acute myelogenous leukemia. And just to say why we put that category up there, the IARC is the International Agency for Cancer, and group 1s, as you can imagine, are like the worst ones. So, but we'll go back to fatigue now. I'm trying to pull this together for you guys who don't have any fatigue. Bless you all for having so much energy. Non-cancer effects, neurologic stuff, skin stuff, GI stuff. Okay, so let's just read this for a minute since none of you had fatigue and say, has anybody else had drowsiness, headaches, unconsciousness, convulsions, respiratory tract irritation, nausea, or vomiting within the past month? You don't have to be specific about what you had, but if you had any of those symptoms, just raise your hand. Man, you guys are passing like all the tests. No, you're supposed to fail. Please, everybody raise your hands and say, I had one of these. Thank you. Okay, so this is the problem. This is the biggest problem. How are you supposed to take this? People walk into my office every day, obviously not you lot, and say, I'm tired all the time. Fix me. And I go, well, that's sort of vague. We got to do a little bit more exploration before we can figure things out. So, anyway, so this is the hugest part of the problem. Cancer, horrible as it is relatively easy to track. You got this case of cancer, you got it here. Now, one of the other problems, of course, is what kind of cancer? Oh, well, so-and-so got AML, so-and-so got bone cancer, and so-and-so got skin cancer. Well, they're all because of the benzene. That's a really hard statement to make. So there again, you get the tracking. And if you don't have massive numbers of people, I mean, studies have to be done on hundreds of thousands of people to necessarily pull out how many AML cases you have. So you can walk around and say, oh yeah, Fred up the road, he's got cancer too now. But you know what? It's just really hard to track it and just make those direct connections. That's where that monitoring and studying comes in that we aren't going to really be able to do. So we can go home now. All right, so we're done with the air. Your lungs are all fine. You guys get to pass. Water. Okay. Half of the mixture that is injected into the wells never gets found again. That was another creepy for me, because you're injecting all this stuff in there and you're not actually ever finding it again. So, half the mixture, therefore, of course, doesn't get treated. It just sits in the ground, which has absolutely no relation to the rest of the world. So, there is wastewater treatment, but not a lot, because it's not too much required. But the wastewater is also transported so that we have the spill risk again, okay? So it's pulled back up, it's put, what they can find, they put it back in the trucks and they haul the trucks down the road. Or they make these big pools and just let it sort of. So, injection wells, which is one of the ways that they reduce the waste, is by re-injecting the old wells and just trying to store it down there somehow, because we know, because there are Superfund sites that are monitored by the government, that's worked so well in the past. But that also increases, they think, the seismic activity, right? So you're injecting more pressure, you're pressurizing more space, you're shaking it up a little bit. So, okay, so how else can we get a little bit of pollution going on? Well, part of this is how we build stuff. So in the creation of the wells, there are parts that are called casings. Please don't ask me what they are. They're just parts that are called casing. You got to believe me. And they can fail. They can be improperly constructed. And in fact, I think I have a stat here that like 6% of them fail right at the start. Awesome number. Yeah. Okay, I could make comments. They're extended fractures. So when you put the water into the shale, you're creating a fracture intentionally, but then you have a lot of sort of other fractures that could accidentally happen. And of course, they can, I guess, hold some water too, because you're never going to see that back, but that's okay. Abandoned wells, of course, then can be another place because, of course, we're not going to maintain them quite as well when we're not using them anymore. And one thing that I did see that was also concerning is that the quantity, the estimate of how much awesome gas you're going to get out of each of the wells is a little over-exaggerated, which means you're going to leave the wells behind that much faster and just go build a new one. So we have improper construction also of the wastewater tanks. So basically at every step in the process, you have a potential for improper construction. Now, I hear you guys when you say, but that's true of anything. You drive over a bridge, you have the risk that that was improperly constructed, right? That something was bad. Are you going to trust the bridge? Are you going to drive over it? You know, the bridge could crash and fall in. That would be where regulations and like watching what people do come into play. But if you don't have those things because you've been exempted from them, of course we know that you'll do a great job anyway. So, as we know, the oil and gas companies have proven this in the past and how good they are at sticking with things. Okay, so the General Accounting Office in 2014 managed to figure out that the Bureau of Land Management, I just love all the letters, I just had so much fun typing them in, failed to conduct virtually any inspections on what they had identified as high priority wells. Not even the routine run-of-the-mill bad casing wells, but any of them that they said were high priority. The industry itself says that 6% of the wells are leaking when the construction is completed. And then they went on to just reassure us by saying in another year that's 7%, and the year after that, that's 8%. So they're failing at 1% per year. You know, deal with it. So Colorado Oil and Gas Commission noted on average, oh, sorry, it was Colorado, not Pennsylvania. That was having 1 spill a day. I'm sure it's not happening in Pennsylvania. Don't worry about that. So groundwater. In 2010, there was a study, and it said that there was a lot of groundwater gas, and they actually used a scientific way to determine this. So I was excited because this was actually like a real study done scientifically, and it looked like it was reasonable data. And they did determine that, now I presume by combustible stray gas in groundwater they meant that they could light the faucets on fire, but they did prove that the lit faucet fires were connected with some of the fracking wells. And they used isotopic evidence to do that. So that was exciting just because it was like a real study that could be reproducible in any area. I mean, you know, if you've shown you can do it in one place, then that is some way that you could monitor, for example. Next time Fred calls and says his faucet's on fire, you know, the county health department can go out and like check the isotopic evidence and figure out which well it's coming from. So, and we haven't gotten into endocrine disruptors. I've talked only about cancer. I've only talked about cancer and fatigue and dizziness and diarrhea, but there's also endocrine disruptors. Now I have to say, for those of you who don't live in like my toxic world, that we ingest and live in just a sludge of endocrine disruptors. Anybody with plastic bottles, just, you know, raise your hands. So, just because these chemicals, I mean, this is like a, you know, this is me validating those guys. Just because the chemicals have endocrine disruptors doesn't mean that everybody doesn't get these on a daily basis from walking across the asphalt. So I don't see what the big deal is. Okay, aquifers. So we've gone from groundwater being, you know, slightly messed up. Well, now we can go to the deep water. So there is a huge problem that I see with what we're looking for, sustainability, right? When they're talking about how great the wells are, they're saying that this is a sustainable energy source, right? Because that's what we should be wanting to have. And this is going to cut energy costs. And sustainability requires that things are recyclable when you use them, like 900 million gallons of water, or that we don't care if we lose all of it. So we have, what they have demonstrated, the US Geologic Survey has demonstrated, is that they have demonstrated that you have reduced stream flows in those areas that they are already fracking. So basically they're stealing the water. And I know that out west you actually sell water rights, and in the east you don't usually, but that's okay because they'll just take it because it's really deep and you don't see it going. So then we can actually use the isotopes. So going back to the isotopes as a tracking mechanism, we use these in medicine all the time. I don't know if you guys have ever had any kind of isotopic survey, but a lot of times we will do medical studies where we're saying, how much does the thyroid light up? And we give you an isotope and it lights up here, kind of thing. So isotopes are very, very useful for us. They are radioactive. But you know, they are useful tools because of the radioactivity and because there's a lot of information you can garner off of what type it is, and you can sort of figure out where it's coming from. So anyway, strontium isotopes were used to track migration of fracking fluids to the shallow drinking water aquifers from the actual fracking shale. And I have to say, go oil and gas companies. In 15 months in Pennsylvania, they actually didn't see significant migration. So apparently that lost fracking fluid is not getting into our more shallow aquifers. Jeanette?
Two things. First of all, the water in an aquifer moves very slowly. And so 15 months may be an insufficient period in which to measure the movement of migration from an aquifer to groundwater. Secondly, the water system in western North Carolina doesn't operate this way. Most of our water that we drink does not come from deep subsurface aquifers. It's mostly groundwater, and it's that's why our wells here can start running dry if we don't have a lot of rainfall. So some of the information that around aquifers and groundwater that's been developed for fracking is more suited to places like North Dakota and Colorado. Just saying.
But point number one that you had about and the length of time that it should be studied still is perfectly adequate, right? So all of this stuff is not being studied for a long enough period of time.
It's been shown too, very recently, and it's going to come out as a very scientific project, that the fracking fluids and the fracking process, once it goes into deep shale, it keeps moving upwards for as long as, I mean, the fissures keep increasing in an outward and upward direction for up to 5 to 6 years. And so there it does reach the shallower groundwater level.
Exactly, but you said the magic word too, 5 to 6 years versus 15 months.
Yes.
Right. So yeah, I think part of this is if you design the good study that's based on scientific evidence, you'll get the right data. But we just didn't find that lost fracking fluid yet. So let's talk about the fracking fluid itself, the list of chemicals. Okay, so we just don't know, actually, because that's not allowed to be disclosed. And you'll be so happy to know that our governor in June was proud to not only bring 500 jobs to the state, and not only proceed without actually adequate testing that he promised he would do, has also signed, that law actually had a little caveat to it that said if anybody did disclose, it's a felony. So, speaking of the gag orders that I spoke about before, I'm sorry? Oh, thank you. So the felony was a little too strong, huh?
Should we stand
Darn
up
it.
and cheer for the governor?
Well, yeah, you know, that's a good question. So who backed it off to a misdemeanor? I'm sure the governor signed it eventually, but maybe he didn't know what he was signing at that point, because I think that goes on a lot. So anyway, what they've already done What they've already done in Colorado and Texas and in Pennsylvania, this is an official law, is that as physicians, we are not allowed to speak to our patients about what they've been exposed to. So I'm sure that that wouldn't happen because we have an awesome legislature and they really truly care about us. So I'm really sure that you guys are totally safe. Don't worry. We will be always able to talk to you about the benzene. However, that's just not the way in the rest of the United States because we're a democracy. I saw this last week and I just loved it. So I just had to throw this in at this moment when I had said the word governor. Okay, the chemicals. Here we go. 750 different chemicals known in the process. We just don't know which ones they are. 650 of the ones we think we know about are known carcinogens. You've got those endocrine disruptors down there, which, by the way, I didn't complete the story about endocrine disruptors. That would be hormones. So if you guys don't want external hormones, don't breathe the air and don't drink the water, and you'll be fine.
Are you saying there are 650 different chemicals used in this process?
As far as I can tell, yes. Yes. And they just have different, because there's a bunch of different ones, right? They're all proprietary, so some people use one, and some people use other ones. But there is a huge quantity of chemicals that are all being involved in. I'm sure tested, they test them. Yes?
There's a Senate subcommittee paper that's available that was produced in 2011 that discloses or more of those 650 known carcinogens. It was a Senate subcommittee led by Henry Waxman. And anyone that would like that list or a link to download that list can email me.
Thank you. Or does everybody know?
The West North Carolina Lions.
I'm sorry?
Ken Brown with the Western North Carolina Lions.
Thank you. Okay. Okay, so, oh, I'm sorry, Jeanette, go ahead. Yes.
In terms of how safe these chemicals are in their known and approved uses, we have a very broken system for testing the safety of chemicals in the United States. Unlike Europe, which uses a precautionary principle where you have to prove that something is safe before it's released for public consumption or exposure, here we release things for public consumption and exposure, and wait for somebody to get sick, and then we wait for them to be able to prove that they got sick because of that particular chemical or formulation of chemicals. And then maybe there's a lawsuit, and then maybe you have a law. So everything that's introduced is a science project on your body and your children's bodies. Furthermore, the way the chemicals are tested is that they're tested in isolation. Benzene is tested in isolation.
Not synergistic.
Ethylbenzene is tested in isolation. Toluene is tested in isolation. And so the safe level of toluene, the safe level of benzene is determined sketchily, usually by the chemical companies. But what we don't test is every time you combine and recombine multiple toxic chemicals, you get new compounds, which are not tested, which are never tested, and which we can't even look for because we don't know what they are.
Exactly.
Can all of these synergy things on the page there create a super toxic because of the combinations of them all being together?
Exactly. So the problem is we don't know, but I think any individual, I can extrapolate that. Okay, so different ideas. One is how much is in it. So parts per million, parts per billion. If you have, okay, I'll give you formaldehyde for an example. Formaldehyde is in baby wipes, diaper wipes. But we are okay with that, right? Because people keep using them on the babies every day.
Your skin doesn't absorb anything,
Right,
right?
because nothing can go through your skin. Especially babies' thin skins, nothing. Thank you. But so when you take a look at that, part of it's quantity. So they've decided that X amount of formaldehyde is okay to have in baby diapers because otherwise the baby wipes would get mold or something and you'd have to throw them away and get a new pair. So when you're talking about these, part of it is how much quantity are you actually going to be exposed to. 650 chemicals, I can't imagine that, you know, there might be like a half a pint of one in there, and then you throw it into the well and then you distribute that. So some of these are like, how much quantity are you actually getting in the fracking fluid, and then how is that getting cleaned versus anything else. So that's always a concept. But then yes, how are they interacting? Because of course they're going to cause chemical reactions, because that's why they're being used. They're being used so that the water flows better. They're being used so that they can get the gas out better, and that's why they're even doing that instead of just putting water in there. So they need lubrication, they need everything to flow better, and that's going to be part of that chemical interaction that's going to be created. So yes, mandatory chemical interactions, we just really don't know which ones, and then how, as Jeanette was saying, how do you then take that and say, this chemical reaction happened in this shale at this point and gave this person cancer. So, but these are the things that that are on the list that we are familiar with, that we know that these are carcinogens. Things over here are not necessarily carcinogens, but I'm sort of putting them on the don't use list because they're regulated by the Safe Drinking Water Act. So my assumption is if they care enough to put it in the act, it's probably not a good chemical to be drinking. So those also are on the list. And then if you compare the two, you can see that there's a little bit of crossover there, right? So here you have a bunch of chemicals that we know are not great, and we know they're not great because they've already been outlawed, but they're going into the ground, because the ground's not the same as what you're walking on. So it's completely different. Okay, so I think we hit this point already with what you guys were saying, right? The symptoms are extremely variable. Multiple different kinds of cancers. And a lot of these cancers are vague ones. Leukemias and lymphomas, for example, the blood cell cancers, are just not obvious. It's not like you're going to grow a brain tumor. It's going to be the exact same type of brain tumor every time. So a lot of times when we get a toxic exposure, it comes up with cancers like these that are just sort of there. Okay, and then renal failure, and then the pulmonary damage from the inhalational stuff that we talked about too. So because these are all so variable and so widespread, that's what makes it so hard to track. Okay, so then we go back to our other people in the environment that can be more or less affected. Children with their smaller body weight, with their thinner skins, they get a much higher toxic exposure from the same quantity of whatever it is, drinking water, basement, you know, whatever. So they can't detoxify things as well, so they have a stronger exposure that way and higher levels. And they also, hopefully, are going through critical developmental periods where their brains change and they mature a little bit. And can you tell I got a teenager? Okay, and so when you have these critical developmental periods and you have things like lead, like we don't know that lead's bad for kids, it's because of these. It's because the lead sits in the brain during critical developmental periods and the brain don't develop as well. So what do we know? We actually have, I was impressed, a lot of the best data actually came out of the baby data in terms of things they've truly studied. This I think is this speaks to more than anything. Our infant mortality should always be improving. Now in the US, okay, that's sometimes not always the case, but increasing 6 times the normal rate in 3 years, infant deaths, that's a no-brainer. That's what I call a no-brainer. Okay, and then to reinforce that, in 2013, the State of the Air report from the Lung Association for Utah, they got an F. Well, when you've got that kind of monitoring going on, I think that's something you can take to the bank. You can say, look, in this state, it was an A, now it's an F. What did we change in the meantime? Oh, 5,000 fracking wells. Okay. No, but I can give you the references. Rural Colorado, I didn't want to put all the data down on the slides because that's busy enough. Rural Colorado, congenital heart defects, neural tube defects, which would be spina bifida, that associated with the density of the wells. These are also things that are pretty, should be in the thousands, because those are, I believe one was at least 25,000, but these are actual state data banks. So what the state does is every time a baby's born and it has a birth defect or there's a death or anything, these are all recorded with reasons and with all this kind of stuff for every baby. So it's not like this is a hit or miss, somebody's got to report this or not. These are all reportable. So therefore, we have very good infant mortality data, which we can absolutely associate with things like the number of wells. So these are basic data that we can actually collect fairly easily, which is probably why there are so many of them out there. Low birth weight babies. There are multiple, of course, then you get into environment. Okay, I won't say that.
Would that be the endocrine disruptors?
No, actually, those are infertility. They just don't get pregnant in the first place. Yes, but good point. But the low birth weight infants, and then they switch to the boys instead of girls. No, I won't go there. Because it's not true. That's not true. But endocrine disruptors are not necessarily causing this, although they may be. But the low birth weight infants, that's a problem. There are so many different reasons why you can have a low birth weight baby that it's hard to associate, oh, I have a low birth weight baby because I'm, standing next to the Fred well 3 times a day, kind of thing. So it's a hard connection to make. My husband works at the fracking well and he comes home and, I breathe his benzene off his shirt or something like that. However, once again, that's a global. We can look at the entire state. Every baby that is low birth weight gets reported. Okay, so that's a data that we can actually track, and 3 different places have tracked it and noted low birth weight babies. Okay, so we've gone through the infrastructure, which is not right next door to you. We've gone through the air pollution, which you may breathe in. We've gone through the groundwater and the aquifers, which you may wash in. But then we get to your house. And they've noticed a couple of different things in terms of the actual effects on the house. And one of them is radon, that you guys may be familiar with because it has been mandatory testing for radon, for example, when a house gets sold in this area for I don't know how many years, but I had to do it when I came. And it wasn't mandatory in other places. I came from Maryland and it wasn't mandatory there. But here it is. So obviously we have high levels of radon already in our basements. It is fixable, it's eliminatable. But particulate matter, so that silica sand that only the transport people and the workers had to breathe in, is somehow coming into the house as well because they're seeing it. So we're raising dust and particles. And in addition, benzene and the methane apparently like to tag on to dust particles. So it's one of those things that they sort of use anytime you have dust, there's sort of a great place for these molecules to stick onto and travel with. So we have just the particulate matter, then we have the radioactive releases. So radon is naturally occurring, can be found, especially in basements, in low levels, can be cleaned up, but that's what really a lot of people are concerned with because this is also something that's coming out of the ground. So you put water in, you put any force in, and like you guys were saying, the fissures are going to keep going. Why? Because you've generated energy. You've created an immense amount of pressure to push this water through the shale. Of course, it's going to go everywhere. It's going to go wherever there's a weak space, right? It's going to go there. And what's it going to push before it? It's going to push before it anything that's already there. You already have the radon. All you're doing is pushing it to the surface faster because you've got a force behind it that's actually doing the pushing. So these 2 things are what they are worried about the most in terms of radioactive substances in your home, the radium and the radon. One's ingestible, one's by inhalation, and both of them are group 1 carcinogens. And of course do other stuff like lung disease, brain abscesses. Okay, So, the last basically impact that I want to talk about is perhaps the one that you guys are already involved in to some extent, is basically increased stress. I spend lots of my day telling people everybody's too stressed and we got to just cool it off. So, on the one hand, you have people that are pushing for this because they have great impacts. It's going to bring all these jobs. It's going to be wonderful. It's going to bring money. On the other hand, what you're then going to have is that's going to drive up the costs of living here, which are already driven up by those other folks that come from other places as tourists and like buy all the houses. And then you also have unmarketable housing when you have too much radon in your basement or other kind of issues. So vulnerable populations are going to be most at risk, right? We've talked about the kid effects, but also the social and community impacts of having this argument that you guys, okay, I'm assuming which side you're on today, because you're here. That may be an assumption on my part. Anybody who supports McCrory? No, don't do that. That's dangerous. So you're going to have people that you're starting a fight, you're starting a stress, you're starting an increased space that you don't really want to create anyway. We need to be looking for cooperative ventures. We need to be looking for sustainability within our community and within our energy system, and we're not going to get that by having this kind of fight. So stress. We'll have stress. How many people have stress? Wow, the most people that raised their hand tonight. I finally figured it out. All right, so I did go to look at the Medical Society. I wanted their opinion. They ain't got none. We can keep going. They apparently don't know about the gag orders, or they may, whatever. Go physicians. Okay, so we've already been over this. This is just my reiteration. If we keep going and using the government to protect us, it's not going to happen because they're already not protecting us from fracking anywhere. So I shouldn't say I don't care about fracking in North Carolina, but I think if you're only looking at fracking in North Carolina, you're looking at a very, very small portion of the problem. The problem is that when you let it into one place, it's going to flow over into the next. Oh, well, Pennsylvania's doing it, and they've got a couple of faucets, but other than that, they're doing fine. We should do it here. So it's not that we shouldn't frack here, because I think, as that geologist said last week, it's not likely that we have the great shale to do it. Although once the wells are exhausted in all the other places faster than they expected them to be, they'll be on our doorstep. But I think the point is, if my subliminal messages got through to you guys, that this probably shouldn't be happening in the first place, right? Because it's just not being done well. It's not being done with us as a center of concern, the people, as it should be. So in any of this space, we need to take a step back and we need to look at the fact that we as people should be protected. As an individual, I should have the right for my government to protect me against pollution. That's not in the Constitution, though. Shoot, we'll have to make an amendment. All right. There are current studies. There are some resources that I found that were interesting. If you want to have a little, if you're bored one night, go to the Toxtown website. It's got everything. It's not just fracking. It's for like hairdressing and everything. So I saw some interesting studies that there was, maybe if we can use the waste chemicals and convert them somehow and turn that into a cost-effective thing, we would have better waste treatment because they'd have a reason to do it. Using different kinds of bacteria to degrade the hydrocarbons that are in there, that kind of stuff. I mean, there are some good suggestions for studies out there, and maybe it'll come up with something. But one of the recommendations that I did see and agree with was that we need a health impact assessment that's a formalized evaluation of what this is going to do. And of course, we need this before the fracking starts instead of like 5 years afterwards. So nobody apparently has done one of these, even in Pennsylvania or any of the spaces that are already fracking. What they have noticed, shockingly, is that there's not enough monitoring. So, this is where I go off the map and stop talking about fracking, but I guess you guys already picked up that I wasn't totally talking about fracking anyway. We need to fix the US before we're gonna fix fracking. So, sorry guys, it's not a small project anymore. But I do think that that thought about somehow we've got to fix what's going on so that the government does not get, the individuals in government don't get rewarded, and so therefore have the incentive to go back and do it properly, right? Because there's got to be some reason that these governments are going ahead and allowing this to happen when everybody agrees that there hasn't been adequate study on it. I have no idea what that reason would be. Okay, so I get to talk about stress all day. You guys are like newbies, so I get to give you the moment. Don't forget to breathe deeply through your day. That's all. If you can spend 5 minutes in nature, it's an extra bonus, and your stress level will go down. Okay, so if you liked this at all, thank you for listening the whole time, and nobody fell asleep. I was so impressed. You can like us on Facebook. Connie is our volunteer coordinator, and we're in Dillsboro at Dogwood Wellness most of the day, most of the weekend. I'm building a yurt, so anybody who wants to come by and just say hi and like throw a couple nails in, feel free. So, okay, that's it. Thank you. I'll entertain questions, but I promise I will send them to the guys in the back who know way more about this than I do. Yes, ma'am.
In the things that you listed about community impact, one of the things that's been brought to my attention recently was the increased level of crime in the towns where the fracking is going on, because the job pool is not local folks. They're coming in from outside, and the transient population tends to increase crime while they're there. At least, have you found studies on that? I mean, I've heard.
I think I saw 2 different studies, and I think I'm not sure that we need necessarily a study versus a history lesson. I think we can look at the oil booms everywhere else and be able to look back and say it's probably the same population coming in. It is a transient population. What happened in those places back then? And we can probably extrapolate to what's going to happen now. But yes, I mean, the 500 jobs, I think that's in part, I guess my interpretation of why there are only going to be 500 jobs in North Carolina is in part because they're going to bring all their own people in who are already trained. And then move on to another well when they're done, and we get to breathe in the cast off, whatever.
So. To me, it's an issue of public safety. So that's
absolutely
one of those things.
Yes, and this is happening in rural areas. A lot of this fracking is happening in the rural areas, and so you're sort of bringing this population in. Nobody's used to it. It is a huge drain on social services. So one of the studies they did was in Wyoming, where they were looking at just how a lot of the social services simply collapsed under the weight of this rush. I guess what you can say is in the gold rush, there were no social services, so they didn't have to worry about it. And in the oil booms in the other times would still give us pretty good data, though, in terms of those being more recent times, and there would have been some social services. Yes, ma'am.
Most people here have probably seen the Gasland movies. I didn't see one, but I saw 2, and I was really struck by one of the things they showed, this gorgeous home that the people couldn't live in anymore, and it wasn't because of radon, it was because of the gas and the water.
Right, so I didn't necessarily pull that connection together, but any of the waste spills and the groundwater contamination is going to result in those unmarketable houses that I put on the screen. So that's where that connection is most obvious, is going to be in the people that are closest to the wells, and that groundwater runoff, or people closest to the spills at the roads, are then going to be, those are the ones that are going to get their houses ruined. Yeah. Unless you want a faucet that glows in the dark, which some people would think was really cool.
I only know this because I actually read my house insurance policy this year for the first time. But if we have an 8,000% increase in earthquakes here, as they did in Oklahoma, your health insurance in North Carolina does not cover earthquakes.
That is a good point. Yes. Yes, sir.
Make sure that your town has a tree ordinance and really make it strong. The town of Highlands is strengthening our tree ordinance. And a lawyer in Atlanta has advised every town to have a strong tree ordinance that'll be able to stop any kind of destruction of your trees. A lot of the legislation is they're trying to eliminate tree ordinances.
I saw a lot of these, and I think that may have been in the North Carolina law, but I may be misquoting, was that removal, since New York did a good job of doing some grassroots legislation and saying no fracking in this town, no fracking in this town.
Right.
What's happened is that now they're making sure that in this new legislation, it says that all state and federal ordinances overwhelm any local ones. So we as Western North Carolina cannot just come up with our own little blanket umbrella. These 3 counties have voted against it.
Well,
yes.
That's what our town is trying to strengthen our ordinances, even though there are some state directives to undo our ordinances, as you said. But our mayor is getting together with other mayors to try to find nature, the tree ordinance,
Right.
will be able to protect
That's
us. Will be able to
Yeah.
protect us. And also, I've got a lawyer who said he would love for me to be on the radio. I'm on the radio in town there. And just to go ahead and announce the chemicals, and let's take it all the way.
Well, and I think especially, I think so too, because of course this was my thought, and I was like, well, I wonder when I'm going to start getting a knock on my door for
You just did a
announcing the chemicals.
misdemeanor right there. 2 weeks ago, a felony.
But I don't know what well I'm talking about.
That's right.
We won't tell on you.
Okay, but
But
he
just
put
have,
it online.
just have a good lawyer.
Anyway.
Just have a good lawyer with you, always with you, before
Might
you
get
do
the name of
anything.
yours when we're done with this one. I may need it. So, I mean, you know, I think this comes also back to the physician gag order. We have to go with an ethical basis here. I'm never going to look a patient in the face and say, I'm sorry, I can't tell you which chemical gave you cancer.
There was just one more thing, and I'll be quiet.
Yes.
An emergency person who comes to try to protect someone or rescue someone, they'll be told what chemicals are there, but then they have to sign something and say that they will not tell you or
Exactly.
anybody else. Disclose.
So I can't provide that information. I cannot call up my toxic expert and say, how do I treat this exposure to, you know, that chemical?
You may be exposed as a doctor and you don't know it.
Right, right. And then that's, I mean, I think the whole concept of this gag order within the medical field is just ridiculous because it goes against everything. I mean, we start our first day saying that Hippocratic Oath, and although a lot of people play golf, you know, a lot of people do some other good stuff, and everybody sort of really maintains that same group of ethics, and just to think that an entire group of people would allow that kind of medical care to happen is really sort of scary. But apparently, I mean, one of the things that I read was they had to get somebody in from New York to talk about Pennsylvania, because now that this gag order has been put in place in Pennsylvania, all the docs are too scared to even have a conversation about it now. I mean, they won't even do this because
That's okay, keep doing it.
I didn't say that.
Well, it seems to me there'd be some basis for medical or a challenge to that, because first responders, firemen, doctors, and that kind of thing are all included in that gag order. So if there's some emergency situation, I can't see how they can, it seems that there must be some way to challenge that.
Freedom of the press and freedom of speech.
Right.
So just go ahead and use your speech. Do it.
Right.
And challenge them, and if you go to jail, you're going to go to jail for a while, but you'll be out.
Mom, you heard what he said to you just from the office while I'm gone. So, yeah, I mean, this is just, the ethics of it are just so patently ridiculous, but for some reason, you know, people are still being scared, but that gets into just, again, everything that's going on in this country. 20 years ago, would that have, I mean, people would have laughed. Nobody's laughing now. That's the scary part.
Henry David Thoreau went to jail because he didn't want to pay his poll tax because the money was going to be used for war. Emerson was outside the jail, and supposedly Emerson said, "What are you doing in there?" And Thoreau supposedly said, "What are you doing out there?"
Okay, any others? Yes, ma'am.
We were a little late, so forgive me for trying to cover this. But in other words, like, why is it that we are not supposed to use the words of these chemicals? What is the basis? What is the basis of not being able to say that?
Proprietary features of information.
The what?
Yes, but when you...
Proprietary blends.
But what I can't figure out is, I don't know what their proprietary blend is. I'm not part of their business. I have no idea how fracking works. So for me to say benzene out loud should not be a crime in any way, except it's part of this entire sort of corporate,
Yes.
if we can squash it, especially legally, then we don't need a death squad.
But is
But-
say that?
But it's
I didn't
because
say
of the
that.
corporate strength through the legislature that this is being allowed because it's proprietary.
Right, exactly, but just once again, I don't get that because I can understand if I'm part of the group of people who create the mixture, I would know what that proprietary blend was, but I really don't know what's in fracking fluid.
It doesn't matter.
It does not matter.
It cannot be
Exactly.
public if it is proprietary information to the chemical company, and I worked on fiber finishes for a number of years. The proprietary information is something they have developed. It gives them a competitive edge.
Sure.
They think, and they don't want to disclose it to anyone else, and so far that's legally acceptable.
But go ahead and fight it because they'll
They're
lose.
people. Because
They'll lose. They'll lose. Just keep fighting it even though it's a proprietary blend. Excuse me, screw it.
Well, I mean, you know, but it's because it's a proprietary blend, it's confidential information, but it's not really confidential information because it's all over the internet. I mean, it's not like I made this list up because I went to a bunch of people and asked them what was in the mixture, because this stuff's all over the internet.
So
Well, as our own House, U.S. House Senate Subcommittee published this whole abstract that lists every single chemical.
Exactly. So I mean, I think I'm being a little
It's just
facetious
scare
in saying that
tactics. They're
this
just
is going to
trying
be
to
like
frighten
dangerous
people.
for us necessarily, because I didn't say exactly how many parts per million, you know, were necessarily in here, and I don't think that's the point. We can still monitor the health effects without knowing exactly what chemicals are in there. Why? Because of the data that I put up there. If we have a 3 times or 6 times increase in the rate of SIDS deaths and infant deaths, I don't care what's in the fracking fluid. Because there's a relationship and the fracking therefore needs to stop. This is a hazard to those children. I don't care what's in the fracking fluid. I don't need to know what's in the fracking fluid. People want to go on a deeper depth, they can, but on just a basic life and death situation, it's a no-brainer. So you had a question.
Yeah, is there any kind of an organization, do any of these organizations that are concerned with fracking, are any of them keeping on top of what legal action has actually taken place with these laws? Has anybody gone to court? I've worked as a home health aide and I've seen the HIPAA law
Mangled.
misinterpreted to the point of where it doesn't, it's beyond not even making sense. It's just like absurd. So I wonder if that's not like what's going, don't these things have to actually go to court and have some kind of established precedent for how they're going to be interpreted about what's in something? You know, what? Whether it's
Jared, I'll throw that to
proprietary
you.
It's
blend
being
or,
worked on right now. There's a whole group of folks, environmentalists, different groups in this state, I know, that are going to meet in this very room shortly to discuss a strategy to do just that, to find some level of relief, hopefully through the courts or if not, some other ways. And so yes, there's great concern in the legal, community about this, and hopefully there'll be some ways to we'll
when
find.
you throw these terms around like proprietary blend, that has to actually mean something very specific and not anything else.
Well, of course it does.
Yeah.
These 650 chemicals that we're talking about here, each one of these companies has their own little soup mixture, so they call it proprietary, and
Yeah.
but they're, generally speaking, though, they're all well known.
I don't want to throw another name in, but Monsanto's been doing it since 1986.
Thank you
You're
for
here.
saying that out loud, because I couldn't figure a way to subliminate that.
Now-
You had a,
Yeah, I just wanted to say that if anyone here would like to get more involved, there's a coalition against fracking in Western North Carolina that's forming. They have county chapters, and so trying to get folks in Jackson County to sign on, and they're going to be participating, what this gentleman was talking about, on Saturday. Some members of the group will be there to hear the larger strategy, but really all the nonprofit work is useless if we don't have a lot of people behind it. So I would highly encourage everyone to sign up, and we'll just send you emails about meetings in the area, and then take it from there. So
yeah, it's gonna have to be grassroots.
I can either pass it around or leave it at that.
What's the name of your organization?
This is Coalition Against Fracking in Western North Carolina, and it's really not it's just people in these areas coming together. Is really all it is. Very grassroots.
You can download the Energy Modernization Act. You can download the Energy Modernization Act and read it if you want.
I was looking for that, but I didn't have enough time. That's what McCrory signed in June.
The Energy Modernization
Energy
Act.
Modernization Act.
Right.
Yes.
About 6 or 8.
Other questions or comments? Yes, ma'am.
I don't know if they're part of the coalition, but there's an informal group in Macon County who are planning to go to the August County Commission meeting, the first one, which I was told was August 12th, not to ask the commissioners to sign anything, but to share information and to let them know that a lot of people are concerned.
Right, and let me say that, coming back a little bit to what I was saying before, there are other ways that we can fight this that don't even involve the word fracking. And this is me putting my statement out there, but I think term limits and an end to corporate personhood are the two critical things that have to happen in this country before we can actually progress in being a democracy again. So, that's just me. Okay, anybody?
Yeah, I'm sorry, we actually heard it on Steve's radio program, and it was just so insane that, I'm aware of New York, but it just seems strange to me that we don't have state rights, that doesn't override this whole issue. And county by county, everybody's talking about state rights, and it just seems so obvious that this would be one of them. And I just have two comments very quickly. We saw in the news that they were asking the scientists, there was a period of time of earthquakes in Oklahoma, and there were like 32. And since they've been fracking, there was 300 and something. So they asked the scientists, they said, is it, and he said, it's awfully strange that, so
That's proprietary.
yes, but it would almost be to me like Coca-Cola saying we can't use the word fructose because we've got it in our brew over here for Coca-Cola. This
Or
whole thing is-
water. We
Water.
probably should stop saying water.
Exactly. This is
That's a good point. Yes, I am implying that water may be in the process, but I did get that off the internet, and we know how reliable that is.
Well, that corporate power that this gentleman was talking about also is part of the reason that they were actually able to pass in this House bill that became law, that municipalities and the council of governments and this kind of thing can't, county governments can't pass ordinances or
against fracking.
Well, and I think there's been that moment always of because we're the United States, we have that issue of being so individualized with our states that sometimes that does set up the conflict. But there's also that understood space of that there are times when the state will overwhelm the the local ordinances because like the California kind of acts that will overwhelm everybody else. Let's follow them because they did it the best. You have
Okay.
Do you think this gag order will be challenged in the courts?
it has to be.
Yes.
I mean the gag.
Constitutional, that's what I'm wondering.
Jackson County.
Well, I'm not.
For,
It affects
Coalition
the
Against
health
Fracking.
of everybody that's going to be involved in fracking in their state, area, communities, and what have you. So is it constitutional to gag our doctors? If it wasn't dangerous, they wouldn't be gagging them.
Of course, but I mean that's why I'm saying just passing it in the first place is sort of ludicrous. But at the same time, I think you'd have to ask a constitutional lawyer whether it was truly, is this a right of free speech? Do I have the right of free speech to have a conversation with you about your health and your health problems and not have anybody else in that bubble?
Well, of course, we have to have, legal advice, because once something comes before the court, laws are established and then argued based on other cases, but see, there's no case law to argue.
No, that comes second,
So
right? Yeah,
that-
yeah,
I'm just saying,
yeah.
we
It's-
need to be banded together, and we need to
Right.
have legal counsel.
All of them have to be argued though. And the fact that what they're doing is the same thing as what Monsanto has done when it wins a case, the same thing as certain places around here, as I am also under a gag order, happens with a lot of places. They get an outcome to make you quietly go away, and then they say you can't talk about it. But that's just what corporate does.
Were you notified of this in any official way, or is it just hearsay that there's a gag order? I mean, did they
I don't
send
have,
you a
I don't have a gag order against me. This is Pennsylvania.
Oh, it's-
Pennsylvania has an actual
Pennsylvania
act that
has-
has been passed that says physicians cannot speak to their patients.
I'm sure they're.
or other
I'm sure they're
providers.
Fighting it, I'm sure they're fighting it.
Well, I just don't see how maybe I won't speak to them, but I can't not document it in the medical record. I mean, that's not legal in any way. I can't commit fraud on the papers I'm writing by saying chemical X, which I don't know what it is. I mean, so some of it's just scare tactics, and it's responding. Physicians are really good at following the rules. So it's sort of, we say, oh, you're going to lose your job if you talk about this. It scares everybody, right? It's not just physicians, I should generalize.
But you'll win, no matter how crooked it is or anything, because I have my constitutional rights violated here in this county, free speech before the board. I got a constitutional attorney. He was going to take it to court, but I didn't have the money to stay in court because there was no case law.
But see, that's the
You see, there
whole
was
problem.
no case law.
You
So he would have to work from the ground up. That could have been 3 years.
You can talk about legislating and suing people all day, but the bottom line is if you don't have the cash to back it up, you're not going to bring the lawsuit.
Well,
Right, and
I
so-
understand.
So I think that's just,
A court challenge is the only way we're gonna win.
but that's also, so I think I did put up, although I didn't see it tonight, the American Association of Physicians and Surgeons is not the AMA. It would be the organization that actually cares about physicians and surgeons and people. And so that is one of the places that I would expect would potentially generate a lawsuit against this group. So if anybody's bored and you want to go online and read them, they've got awesome information.
What about Physicians for Social Responsibility? Do they have any kind of action?
I didn't look. The Act 13 that I saw, I really saw no discussion about it in terms of how physicians were responding. And I didn't spend a lot of time looking it up because it was sort of a portion of concern and not like the core of the talk. But there are several groups out there that are not the AMA.
Be very calm when going to your town board meeting. Go to the town board meeting, your next one, and ask your town attorney and your town manager, are you getting anything from Raleigh? Did you get anything from Raleigh today that we have to change? And let us know what that is, and just be very calm about it, and go from your town up, instead of going from the feds down. Just go get an attorney, have an attorney do it, and go to your town board commissioners and have your mayor talk to other mayors, and then talk with the community hospitals and see what they're doing. Be very calm and very loving about it.
Yeah, somebody else is going to go instead of me for that part of things, but.
Speaking of a local issue, that, I just want to say this in front of a room full of people, because I have already asked people at the county about this, and I asked Sarah Graham to ask this question at the town meeting. 3 months ago, I applied for, actually it was March or April, I think, when I applied for a well permit for a new, well on my property. When I got the permit, it had an option for hydrofracturing on it. This was long before the state law was passed, long before. And whereas it costs $300 to get a water well for your house, it costs $150 to get a permit to do a hydrofracturing well. I want to know how long that's been on the form and who put it there. That's what I want to know about Jackson County.
Sweet.
And who put it on and where did that suggestion come from?
Yeah.
That's not proprietary.
Right. And we'll make some money off of it, so that's all we care about.
There is an opportunity to have input with the Energy and Mining Commission in terms of the rules that will be put in place in January. There are 3 meetings scheduled, one in Reedsville, and I believe it's August 25th. There's one in Raleigh, and then there's one down further east.
Those are the ones that didn't get scheduled in Western North Carolina, right?
There are
Okay,
none
yes.
in Western North Carolina.
There is a big move to schedule one in Western North Carolina, and we got a response from Jim Womack, who's the head of the commission, saying that possibly they would do it between August 15th and September 15th. So people sending in just an email to him, to Jim Womack, saying that you would like a hearing out west is helpful.
Just remember the tree ordinance.
Yeah.
Tree ordinance. Don't let the tree ordinance be eliminated or softened. Make the tree ordinance really strong against any trees being cut down to allow a fracking derrick. That's what your town can do to protect it. The trees will save us.
Yes, sir.
If you're a property owner, what you can do to protect yourself is talk to an attorney about obtaining the mineral rights for your property that protects what's underneath your property. Everyone tends to assume that you own from what's on the surface down. That's not the case. If you don't purchase your mineral rights, you don't own what's underneath you. And you're giving up your rights to the mining company if they happen to come your way.
Who do you purchase it from?
Go talk to an attorney that works with real estate and land.
But is it the state
fine.
that owns the mineral rights?
The state, my wife read an article about the fracking law in the state, and if you don't do something to obtain your mineral rights, they carte blanche take them from you and allow the mining company to have them if they come in your area.
Oh, that's awesome. Can you imagine? You could be like, you can't frack here. My 1 acre.
Yeah,
Good luck with that.
To the bill has compulsory pooling in it, so they can go down and underneath with your permission.
If there's five property owners, and 3 of those people decide to give up their rights, and you don't, they can drill under your property without permission. That's the forced pooling.
Gotcha.
If there's 5 property owners and 4 of them have 1 acre and 1 of them has 40 acres and that 40-acre guy decides to go, it's 90% of the acres,
right,
not
exactly.
the owners.
Right.
So talk to your big property owning neighbors. There may be somebody here who knows more about this than me, but I read on the Sylva Herald's Facebook page that the town board is considering a resolution against fracking tomorrow morning, 9:15 a.m. I'm assuming tomorrow is Thursday.
Yep, usually.
The Sylva Town Board.
Sylva Town Board tomorrow, 9:15 a.m. in Town Hall will be considering a resolution against fracking.
Webster passed one last week, I think.
Yeah, Webster.
The resolution is on their Facebook page.
Yeah, but I think part of it is being a little bit more subtle and looking at those tree ordinances too, is that's the subtle way to do it, is to pass, like, have 10 legislations, 100, that all just make it that much longer for anybody to be able to do fracking. Martha?
So would it help to Facebook the town board at this
I don't know, do we know, is Sarah on the town board? Is that why you mentioned her name? I don't know who's on the.
She's on the planning board. She was
Oh.
asking questions.
All right.
Sorry, I said town board, the planning board meeting.
So, yeah, absolutely, to make any kind of comment, of
Before
course, to,
9:15 tomorrow morning?
yes.
Okay.
Gary, hasn't Webster already taken that up? And they said no.
Yes.
Yeah, so
You're correct.
I think looking, like, these are all great steps, but definitely looking back at, like, our risk of hydraulic fracturing in this area, we probably have a small proportion, so it's great that we're making this statement. But absolutely part of the key is pushing it out to the rest of the state, to the flatlands, and also just doing this universally.
Thank you for saying that.
I have not been watching the national news as much as I used to. So the question is, like, is the national news picking this up about the gag order?
No.
No.
I'm certainly, like NPR, I only listen to NPR on my way in, and
So maybe
it
that's
hasn't said
another-
anything about it. but-
Another tactic is to get someone like NBC or CBS picking this up?
It has appeared in USA Today.
That's
I
about it.
can't imagine. But see, this is part of the scary.
Oh.
This should be something that everybody should be like, oh my God, we should talk about this, and yet nobody's picked it up. Yes,
Local
sir.
news, WLOS had a story on it.
No LOS. All right, I'm gonna, oh yeah.
The local town ordinances help protect the county. Anybody who lives outside of the town city limits vulnerable, so we need to be dealing with our county commissioners, and our county commissioners board is loaded with people who are pro-fracking. So we need to be thinking about getting the message on.
And we can change that coming up here shortly, right, anyway? No, but, I mean, like, there's elections here, right?
This is
Yes.
I think it's
So-
scary whenever so few people know what's really about to set your house on fire and nobody knows anything about it.
Yes.
And that's what, it's scary.
But part of this is that fresh blood kind of concept too. If the board is pro-fracking, we encourage a board that is not pro-fracking. And part of that's also just getting fresh blood. The more we circulate fresh people through anything, the better off we're gonna be. Which goes to some extent back to the term limits, but we can do that very simply by going, who's the incumbent? All right, let me put the next person up on board.
Well, the mountain people.
Sort of simple.
Put that in a water fight with Alcoa, trying to maintain our hydropower. They will turn out if they know. And they did it. But I'm saying it's scary because they don't know.
Yeah.
I get called all the time from these political surveys about who's running for this and that, and they called me the other night about the senatorial race. And then they asked me what my issues, what was a concern to me. And they ran down this long list of things, and at the end, they had other. So I said, other, he said, and what is that? And I said, fracking. And the guy didn't even know what I was talking about, you know, they didn't even.
That is
right,
part of
It
it.
wasn't even on, like, even on, listed on their survey at all.
But this is sort of endemic in terms of the problems that we're going through in the first place. You know, is that people need to be educated and involved. And if you don't have educated and involved people, you get stuff that happens when nobody's looking. So I'm gonna thank you guys. I'm sorry. You guys can keep talking. My feet really hurt, so I'm gonna say thank you for coming, and I'm gonna go somewhere.
Before everybody takes off, there's a list of